causes a hormonal imbalance in the female, and that lead to this. So I had an example of Kareena Kapoor Khan. Okay, so this is what confusion of identity. Nowadays, this is a trend, but this trend is because of these confusions. Okay. Another things, when we see Mani's habit of the girl. So initially we took the Mani's habit of girl rubric, but in this case, when we see the Mani's habit of the girl, it is also the confusion at the hormonal imbalance which lead to hormonal changes. So when it goes higher version, it causes duality. Either am I a male or a female? This is a duality, and so the rubric is confusion, identity, duality, sensation of the higher version. Another addition by my sir, Dr. Suketu sir, who taught wonderfully about this cell psychobiodynamics to me. And in that case, whenever you find a woman having a mannish habit and having confusion due to over responsibility, and which lead to deeper pathology like autoimmunity, then you can think of the higher version. Duality to higher is depersonalization, confusion, identity, depersonalization if it is autoimmunity. Are you getting me? A small difference, but that is in a practical applicability. So the summary of these, you can use this rubric in this parameter. So face related pathology, hair, baldness, alopecia, PCOD, teratozoospermia, gynecomastia, adenomyosis, dysplasia, cancer, genetic mutations, autoimmunity, and neuropsychiatric disorders. Still my presentation didn't end. So mind rubric mapping to the cell psychobiodynamics, that means which rubric is applicable to which cellular pathology. Okay. So as we know up till now, the core idea is as in the mind, so in the cell. So rubric of the human mind represent the perceptions, belief, reaction, distortions. These perceptions, when chronically unresolved or unconscious, mirror in the cellular consciousness, creating pathological tissue level behavior. Hope you got this idea. Okay. I remember Bruce Lee's quote that Bruce Lee has said about the quote of spelling. Either you spell the good or positive, don't speak negative words, your cell can hear that negative word and react accordingly. So this is what the Bruce Lee words. So same way, when anything chronic, unresolved or unconscious at the perception level in the form of either a belief, reaction or distortions, it can mirror at cellular tissue level. So simple understanding that tissue behavior is equal to pathology. Find out the cellular attitude, mind of pathology, corresponding to mental rubric, and which is according to the miasm. Hope you get the idea. This is what the 4 step. Okay. So if it is inflammations, so cell overreact defensively to pursue threat. If there is no threat, cell cannot go into inflammations. So irritability, anger, oversensitive is Psora. If it is accumulation either of the mucus, fat, water, that means what? Cell want to store excessively. Why? Feeling insecure and deprived. So fear of poverty, anxiety future about, greed, desire more than she needs is the psychosis. Indurations and hardness, so cell become rigid, defensive, hypervigilant, obstinate, rigid mind, dwells on past offenses and psychosis. This is psychosis excess. So here I would share one of the case. A case of a 44 years lady came to me recently in last month and having a complaint of a left knee joint pain and unable to walk, unable to bend the knee joint. All the reports, MRI, X-ray were done. Nothing is found in this case. Only MRI shows mild mucoid degenerations in the knee joint. The rest, everything was absolutely normal. She consulted 3 orthopedics, physiotherapists, but all says nothing will happen to that. So this is what the case with the me. So now what I need to understand from this, no history, my assistant asked whole history about that. The patient denied nothing, no conflict, nothing, no pride, nothing. So my assistant stuck with the history and came to me that sir, patient kai boltu nathi. Okay. Then what happened? Body is telling, so why should I ask the patient? Okay. So in that case, what I thought is, I remember sir's understanding, when the body is telling you something, focus on body. So the patient is having a very sensitive patient, a female patient, and having a left-sided affection. So what I learned in earlier days of SIRS, right side and left side. So right side suggests that the patient is very strong-willed, very practical, meticulous and everything. Left side suggests that the patient is sensitive, hysterical and everything. And also sir says that the left-sided means the psoric inflammations or either Psoro-syphilitic is left-sided. Mostly psychosis goes to right-sided. This is what sir has told in Genetic Materia Medica. So I remember, I asked myself that this patient is showing me no inflammations but left-sided affection. That means inflammation is not there, but there is a pain and affections and stiffness and everything. So there is something which is called as hysterical. So I understood from the hysterical point of view that the left side is affection. Then I convert this patient pathology into rubric of mind. So what knee represent, as we all know after learning SCPH and SCPH plus, that the knee represent the pride, knee represent the esteem, knee represent the performance, knee represent the ego. So in this case, what knee represent? She don't want to bend, unable to bend the knee. So this is what the rubric you have to understand from the perception of that. So I need a hysterical remedy and those who don't want to bend. So what rubric comes into your mind? Are you getting the case? Very good. Defiant, absolutely wonderful. Then haughty, very good. Haughty in mania, egoistic, defiant. Okay, fine. Now differentiate according firm, change aversion to, very good, fine. Now differentiate according to the miasm. What miasm is in this patient? Patient having no pathology, no inflammations, okay, nothing is there but stiffness. Miasm is obstinate, rebel, yes, headstrong, very good. Miasm, stiffness is there. So miasm can be psychosis, but this psychosis having a perception of hysteria. Okay. So this is very important, you have to understand. So the Dr. Farhan Khan has cracked the case. It is a rigidity. So I took the mental rubric is rigidity. I don't want to bend. I don't want to. So in defiant, I have to define this way or I have to throw this way. So that is a defiant. But I don't want to bend. That is the rigidity. So stiffness at the level of body, which represents stiffness at the level of mind, is called as rigidity. So it is the hysterical. So I took the rubric rigidity, and the second rubric is inflammation, joint, extremity, hysterical without swelling. And to my surprise, the remedy come is ignatia. So ignatia is one of the hysterical remedy. Never bending, positions, loss of positions gives rise to changes in the biochemistry at the cell level of ignatia. Hope you got this. Moving forwards, so if the pathology is looseness or atony, so cell become weak, passive, unable to hold the structure. So mind of cell is resignations, helplessness, or powerlessness, or forsaken feeling. Psychosis less. If it is a sclerosis and fibrosis, that means the cell overcompensate with chronic defense or locking itself in the armor. So most common ailment is long continued grief, suffering silently, inability to let go, or person having delusion injured being. So psychosis access, last tumor. So in tumor you can find out the insecurity and being injured. In necrosis you can think of hopelessness, sadness, despair, delusion, doom being. And in apoptosis you can think of self-sacrifice, duty bound, or martyr complex. And in last but not least, when you find out cancer, so cancer is the cellular insanity. So you can take delusion, delirious, chaotic, insanity in cancer cases. So hope you got an idea of cell psychobiodynamics. Now last case, and I will end up this with the session and then 5 minutes of question answer. So this case of a 29 years female, a tumor slide. Okay, take a screenshot. Fine. So this was a 29 years female patient having married life of 7 years, diagnosis endometriosis in left ovary, which was operated, but again she developed that and not able to conceive. And the laparoscopic report shows grade 1 endometriosis, patch on posterior surface of the broad ligament of peritoneum. By looking this report, I had take one rubric from cell psychobiodynamics and prescribe. What is the thing? So this is what the report is. Here it was shows that endometriosis with the patch on the posterior base of broad ligament with the peritoneum. So it was misplaced, absolutely, but it is something that there is there in that. Disposition is diligent, interested in arts, doesn't like maths, very fearful and timid. She used to have a lot of fear in her mind, fear of height, fear of dog, fear of painful procedure like HSG, fear of pain and suffering. Even she had fear that fear of delivery. During USG, she used to have a pain. So gynecologist says, if you can't tolerate this much of pain, how can you deliver the baby? And that fear is more and more. So mind is constantly in a state of fear. So what rubric you can think? So on the basis of this rubric, endometriosis means what? The cell has gone to another place. So we can think of misplaced, we can think of something else. But this cell is adhere to the broad ligament and peritoneum. What is this? And what the mind is there in the body? So mind having a constant fear. So if the person is very fearful and having that, that means what? Delirium frightful, clinging, very important, Dr. Gaurav, clinging. So I took the rubric from cell psychobiodynamics, clinging to bystander. So ovary does not stick to the peritoneum or intestine, it has to remain apart. But due to lot of insecurity at the ovarian cell, it cling to the bystander. And what is that? All the phenomena comes from the insecurity and fear. So fear, delusion from. So delusion is the fear. Okay. So the remedy prescribed is tramonium 10 and within 3 months her USG is absolutely normal. Her USG is absolutely normal. Both ovary shows normal size, equal textures, multiple small follicles, nothing else, everything is fine. There is mild free fluid in pouch of Douglas. So this end up. So this system of healing shows that our fear, our cares, our anxiety that open the path to invasion of illness. As a herb heal our fear, our anxiety, our worries, our faults, and our failing, then the disease, no matter what it is, will leave us. And may we ever have joy and gratitude in our heart that the great creator of all things, in his love for us, has placed the herb in the field of our healing. It was Edward Beck said this rightly about this. Clinging to bystander, and second rubric is fear, delusion from. So believe in yourself and you will be unstoppable. Thank you for listening me since 6 hours, and thank you all.
Thank you so much, Dr. Amit Goel. You have literally given your whole 18 years of experience and knowledge in such a short time. You've exhausted yourself, giving and you've given all the time. So we are very, very thankful to you. And you have actually taken us from, the sir's journey and your journey together from whatever sir has taught us. Actually, you have taken everything about Sir in this 6 hours. It was really, really helpful. And it was great listening to you. It was excellent lecture. We would like to invite you more later on to talk more on this cell biopsychology. So, because you've already done the background part, the foundation has been made, and now we have to elevate ourselves further. So I'm very, on the behalf of IHP Mumbai team, we are really very grateful for accepting our invitation and coming on this platform. And I'm sure Dr. Vijayakar will be very happy from about seeing the hard work that you put into all this. And we are very grateful to you. Thank you so much.
Thank you. It's all because of Sir's blessings. I am sharing this knowledge with all of you. It's not, nothing is of mine. I have just work with the Sir's knowledge and just apply in my practice, and I am just sharing with all of you. So thank you so much. Thank you IIHP. Thank you President Ma'am. Thank you Vice President Ma'am, and thank you all that you have given me opportunity to share my little knowledge with all of you. And if you all are benefited, please do share with me your understanding and your application with me. You can have my contact number, so you can share with me so that I can add that experience into my collections of knowledge, so that will help you all as well as me in return. So
Sure.
thank
We
you
will
so much.
add you in our WhatsApp group so people can connect with you. And
Sure,
of course, they will
sure,
give their
sure.
reviews also on this
Thank
session.
you, thank you, thank you, thank you.
Thank
Any
you so much.
questions if you have? I have 5 minutes, so we can have a question answer if you have. Otherwise, we will have a question in groups, Madam said.
Yeah, that will be good.
Yeah, that will be good.
Definitely.
Too much 6 hours, 7 hours of lectures.
No, no, it was
Yes,
not too much,
delirium sepsis,
but
Dr.
we need
Surbi, I
to,
will answer your questions in
yes,
so that you will get the idea.
yes, yes. So we can do it on the personal chat or we can do it on the group chat also.
Yeah,
And
yeah.
definitely we are looking forward to another session so that, this mind of pathology is what the main practice oriented thing is right now.
Yes.
Since we are
Sure,
getting type
sure,
of cases. So
sure.
definitely we would definitely look forward to it.
Okay, okay.
Thank you so much.
Thank you.
And
Thank you
again,
so much. Thank you all being with me in a 6 hours of span. Thank you so much. Thank you.
our pleasure. And members, please take note of the picnic and about the October session. We will definitely send you messages and please revert back. Thank you so much, everyone. Thank you for listening and interacting. And we look forward to more cooperation. Thank you.
Thank you. Thank you so much. Thank you. Thank you all. Thank you.
Thank you.
from Australia, sir. We want more person from Australia. Australia, so Australia.